In the spring of 2020, our world shut down. By the summer, a time supposed to be full of friends and vacations, we became completely cut off from each other. And as many of us took to online shopping and DIY projects, frontline workers like Dr. Sumita Khatri worked tirelessly to keep patients alive.
I was just waiting for the day the vaccine would come out. I was just praying for something that would help reduce the burden on the health system, give us a break, but more importantly, give space for people in the hospital who need to be in the hospital because we were overcrowding and there's so much delayed care.
Khatri is an asthma specialist at Cleveland Clinic and a board member of the National American Lung Association. She says there was a time during the pandemic where there was no end in sight. Many people coming into the hospital never left.
There were many sleepless nights and a lot of stress around that. And I'm just grateful for how this vaccination program was implemented in a scientifically rigorous and I would say very innovative way to provide us these vaccines, which reduced the rate of death. So at least, people got sick, but they weren't dying.
After a couple of years, the fear of COVID-19 took a back seat to the public's need for normalcy. And even with the new vaccines, Khatri thinks our society has overcorrected in our attitude surrounding COVID. After spending so long in fear of becoming sick, many of us have become indifferent to both the virus and vaccines.
We need to put the genie back in the bottle, literally, by damping down community spread, getting this down to, okay, if people are going to get COVID, they're going to have some protection with these updated boosters, especially with this Omicron variant. And that's the only way where we move on and make it close to the flu. So yes, that's the goal. We live with it perhaps seasonally, but we cannot let our foot off the gas, and we have definitely gone too far in the other direction.
Even those of you who got the initial shot may haven't returned to also receive the boosters.
About 80% of people in the US have had one vaccine. Okay, that's fine, but that only 70% have been fully vaccinated, even though this has been out now for such a long time, and that only 33% have been boosted with 3 or more doses in total. I mean, we can do better than that.
But if you already got the vaccine and the initial booster, aren't you fully protected? Why should you have to take more time out of your day to get vaccinated against a new variant like Omicron?
You don't want to miss the one that is actually specific for the one that's going around right now. That's exactly what we do for the flu virus, although we're a year behind, but we're anticipating what the flu strain will be. And that's what we change that vaccine yearly. So I very much assumed that this COVID picture would become like a flu picture. And then honestly, if it's available, why suffer?
The CDC classifies the impact of variants in 4 ways. Variants being monitored, ones of interest, ones of concern, and finally, variants of high consequence. Currently, 11 of the 12 COVID variants are classified as being monitored. This category means these viruses aren't being heavily transmitted and don't pose a high risk to public health. However, one variant has made its way into the category of concern, which is reserved for more severe illnesses. This variant is called Omicron.
It seems to be more virulent. And what that means is it seems to be more contagious. And also when somebody catches it, they get sicker. So even when we were able to get immunized from that original COVID virus, it mutated because it loves to spread, right? But it shouldn't kill its host, the human. But it was then starting to. So then it morphed and it became another virus another variant of the virus that started to become very contagious. And what's the issue with that is perhaps people didn't die as frequently, but they were still getting sicker because we didn't have that immunity for that.
Which can lead to more hospitalizations that put further stress on the healthcare system. However, this fall, the FDA approved 2 updated boosters that target the Omicron variant. Khatri says these shots have already proven to reduce hospitalizations and the severity of the illness.
And more importantly, we did see a reduction in long COVID. And, there's a new term now called mid-COVID or medium COVID, like mid-range COVID, that basically it may not be years and years, but it's definitely more than months. We don't really know all the long-term effects. And if you can reduce the prevalence of long COVID, it will, again, let you be back to being more productive again, not getting as tired, not having the fog and the headaches.
But even with these protections available, many people still haven't gotten fully vaccinated. Khatri thinks the reason is something called vaccination fatigue.
I'm also really concerned that the pendulum is swinging to such an extent that they have so much fatigue from these multiple vaccinations that they're not even wanting any vaccinations. But this is technology. This is adjusting to what's coming at you. So we should be quite impressed with what's going on as opposed to being frustrated. And I just want that message to be out there that if you could take a pill, you might have done it, right? But it's a shot. It's a different type of treatment or preventive treatment. So I just wish that people would sort of adjust their mindset to think that way.
Especially as we're all going out regularly to places like bars and sporting events. When society first started opening up, masks were still required to enter most businesses across the country. Now, many of those mandates are gone, but the risk of catching COVID is still high if you don't have any protection from either antibodies or the vaccines.
We are very fortunate that now we are able to get together again. This was just not possible in the last year or two for so many people. Getting back together in a responsible way will protect everybody. First of all, you won't feel bad that somebody else got it because you brought it to them. And then, other people who are vulnerable won't suffer, people who are immune suppressed, older, people with respiratory diseases and diabetes or cancer. And when that happens, when you're thoughtful about prevention, then everybody wins. Just think about when you have the flu, you don't hang around with everyone else, right? You just have to be diligent and just test before you get together, especially if you come from a different area of the country or have a different group that you hang around with when you're coming together for these gatherings. We can't just be thinking only of ourselves. We do have to think about our neighbors, the people we're next to in the stores, our vulnerable populations, people who are healthcare frontline workers. Just wanted to mention that if it's a nuisance for you and you just wonder why you should do it, if it's not for you, maybe do it for them.
If you're wanting to make an informed decision about the COVID vaccines and boosters, the CDC offers a complete guide to the different options on their website. You can find more information about Dr. Sumita Khatri and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. This segment was brought to you by the U.S. Department of Health and Human Services. If you've had COVID, you can get it again. And next time, it could be worse, especially for those 50 or older or with a chronic condition. An updated vaccine gives you better protection from COVID's worst outcomes. Find COVID vaccines near you at vaccines.gov. Coming up next week on Radio Health Journal.
A lot of people thought, oh gosh, there's this narrative of more and more women dying during childbirth. And while that's part of the problem, a big part of the problem is that people are also dying later in that first year postpartum.
Why are more and more mothers dying in America?
Then how experts help first responders overcome their PTSD.
It's not that I'm crazy. It's not that it's abnormal. I'm a normal person having a normal reaction to an injury that was sustained in an abnormal event.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I woke up with all of this extra stress that I could actually feel in my body. And so for me, it was doing that intense, short workout.
The quick changes you can make to better handle stress this year. Then,
what they were able to do, unfortunately, was use weapons to have a physical attack on the power grid, which unfortunately did cause an outage in North Carolina.
Understanding the rising number of attacks on our nation's power grids. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.